You're welcome to Development Corridor. Mr. Beta, you're welcome to the house today.
Thank you very much.
As always. And Kingsley, I think you'll be talking to Beta today too. Thank you for it.
We'll try to make the thing good.
Yeah, I was thinking that when we'll continue this discussion, it was going to be on the police service or the policing in Nigeria generally. But it appears today we'll have to talk on health, because health is wealth. You know, health
those are some of the key areas.
Health is everybody's business, and the way our doctors are moving out looking for greener pastures, you know, or looking for even pasture itself. It's
no,
really,
not even the green one.
No, not even that green or brown. You know. So Mr. Beta, what is happening in our health sector generally, the health services?
Thank you very much. It's really pathetic what is happening in our health sector, looking at it from different perspectives. One is that the economic situation has made it more difficult for the ordinary man to be able to afford the price of medication. Like if you go to the hospital today, you'll be shocked that people die for as much as not being able to afford 1,000 naira to be able to buy the prescription drug given to them. Not because the sickness can't be treated or because they don't have money to buy the requisite drug. Secondly is the state of our medical institutions. I'm sure you've seen the current scenario where there is a lot of misdiagnosis among patients. You go to the hospital, the doctors are not able to diagnose accurately what is happening to you. They are treating something else. And unfortunately, those people end up dying. You look at it again from the other infrastructure perspective. The level of infrastructure and medical equipment in our medical hospital is pathetic, like I said. A lot of them are broken down. If you want to do dialysis, for instance, there are very few hospitals or centers in this country where you have to go and do dialysis.
And most of them are private.
Or some of these, complicated medical exams, scans, and all that. You find that there are only few places that have the requisite equipment and knowledge and personnel to be able to handle it. Then the most disastrous situation is the number or the level of our medical doctors in these hospitals. You find out that on a consistent basis, the doctors in our hospital is continuously being depleted. A lot of them are leaving the country for greener pastures. So you find out that the quality of personnel remaining behind to be able to manage the patients in this country is very abysmal. I'll give you an example. WHO in their recommendation, in terms of the number of doctors per population, recommended at the barest minimum that you require one doctor for 1,000 people in any country. Now, but the thing that will shock you is that in Nigeria today, we have about 35,000 to 40,000 registered medical doctors in the whole country. So you can now see the ratio of 35,000 to 40,000. This is a Nigerian Medical Association
treating
record.
Over 220 million people.
220 million. Using the WHO statistics, at least we need the barest minimum of about 200,000 doctors in Nigeria today, or 220,000. But we don't have. What we have is 35,000 to 40,000. And then you see the concentration of these 35 to 40,000 is in the urban areas, in the state capitals, in the local government or in the remote areas. You find out that there are thousands and hundreds of thousands that do not even have access to a medical doctor.
Interesting.
So you find out that the situation is very bleak.
Yeah, you mentioned issues of misdiagnosis. this misdiagnosis, because unfortunately in Nigeria, we don't take professional responsibility seriously when it comes to medication, that is doctors' liabilities or lawyers' liabilities. We don't. We just say, "Oh, it's the will of God." In time don't reach, and that is why he died. Because we are very religious. So those misdiagnoses, has there been any kind of empirical data leading it towards the instruments used or the knowledge of the personnel?
Okay, let's start from the knowledge of the personnel.
Yeah.
And that's why a lot of people sometimes go to teaching hospital.
Yeah.
You find out that the medical opinion as per the condition of a patient is usually not, ideally, is not supposed to be the medical opinion of one doctor.
Okay.
You should have a college of doctors that will come and look at the situation, and within themselves they discuss and agree as to what is the actual condition.
Yeah.
Now, but when you do not have doctors,
Sufficient
doctors, you're privileged to see one doctor, and the doctor's opinion is final. Secondly, how many people in Nigeria can afford the cost of getting a second opinion as to their medical condition? You just go to a hospital, the doctor tells you this is it, and you take it. In ideal situation, you're supposed to go for a second medical opinion or a third medical opinion. But you now find out, which is also the sad issue. For instance, it takes about 10 to 11 years after medical graduation to be able to qualify as a specialist doctor. So how many of those doctors in those hospitals, private hospitals and all those things, are specialists? To be able to be a specialist, that means you have met different conditions and your level of exposure and knowledge about these things are so high that the margin of error is very minimal. You've been exposed to so many things. But you now find out that doctors just graduating from the hospital, from the university, they just get a job, and those are the people managing some of these complicated cases.
And half of the times they are not even concentrating, they're also thinking of how to japa.
Not only japa, a lot of doctors today don't consult for just one hospital.
Yes.
They have their primary job and they consult for 3 or 4 hospitals just to be able to make ends meet. And you don't blame them. The average salary of medical doctors in this country, medical officers, is between 250,000 naira to 500,000 naira, per month. So assuming you pay a doctor 250,000 naira, what is he going to do for the doctor? After having spent 6 years, studying medicine, you spend another 1 year doing internship. Okay, then you now graduate, they pay you 250. What are you going to do?
That's if all things being equal.
So what are you going to do with that amount of money? Now, vis-a-vis doctors abroad, the same medical officers that were paying 250,000 to 500,000, guess how much they make outside this country, like in the US? You find them, they make about 220,000 US dollars. 220,000 US dollars.
That's annually.
Yes. Some of them up to 300,000 US dollars.
Senior ones.
Just medical officers.
Oh, medical officers.
Yes, specialists earn up to $700,000 per annum. So you now compare it. The guy is struggling with 250,000 to 500,000 per month. Meanwhile, out there, he can get $220,000.
He would naturally move.
Why will he stay?
Okay, so I wanted to be clear about something, because we have a lot of schools in Nigeria, both government and private, and most of them have medical colleges. Now, from the analysis you gave us, you said between 35,000 to 40,000 doctors.
Yes, registered
medical doctors. That's with their
board.
body.
Yes.
Board.
Now, all of the ones that are chunked out year after year, do they all travel, or are they frustrated by the system and some of them branch into other health sector like NGOs and all that? Then, we also know that doctors can't be doctors in hospital alone. There are other medical personnel that are involved, lab
That's right.
scientists, pharmacists,
Nurses.
and all nurses. Are there also shortage in this respect?
Okay. Now, you see, just like the question you have, there are about 40 registered universities that offer medical science, that produce doctors in this country. Annually, the estimate is that these 40 universities produce about 5,000 medical doctors annually.
Wow.
Now, but the interesting figure is that about 5,000 doctors leave Nigeria annually. 5,000 medical doctors leave Nigeria annually to other places to work.
But I'm also worried about something. Maybe I'm behind in data. We have doctors leaving. We are crying that we need doctors. But there are quite a lot of doctors that are unemployed.
I can not even conceptualize that doctors are not unemployed.
Yes, they are.
Well, it maybe it's a possibility, but the funny thing, all it takes for you to do, like I've seen it happen, a lot of young doctors, they graduate from university, they go abroad for their professional or certification exam, they pass, they never come back. So those ones that are doctors,
So they're probably not interested in working here. Really.
I don't understand why a doctor in Nigeria should be unemployed. Because let's even assume, how many hospitals do we have in Nigeria? Like, we don't have enough already.
Exactly. That could be the gap. That was where I was to go. Because the hospitals can only take that much. Okay, knowing that this is funded. If you say the government, they are funded by budget.
Yes.
Limited. So they can only pay that much. They can only take that much. So when the hospitals and the facilities are not all there, the doctors are willing to work, and you understand, and the entire society are facing shortage of doctors. Not only doctors, they are also facing the shortage of hospitals where those other redundant doctors should be working on. So that could be where the unemployment
I think
is coming.
there's something, if you talk about the unemployment of doctors, I talk about what I see, a lot of doctors that come out from medical school, they have to go for housemanship.
No, even after housemanship.
No, so during the housemanship, you get a doctor that he will sit at home for 1 year. He will not have an institution to do housemanship.
Okay.
Yes.
Okay, in that case, yes, it's possible. Now, but you see, you know why I find it difficult to believe? If you go to any hospital, you'll be shocked the rate of people, the rate that doctors are leaving those hospitals. I actually went to one hospital. I was discussing with the people there, the staff. The chief medical officer of that hospital left, took a job outside. Not to talk.
Who else can be well paid?
If not the CMD.
So all the specialists, all the consultants, you go to one hospital today, you see the person. Tomorrow you go back, you can't see the person. Or you're talking about nurses. Most of people today go to nursing school in Nigeria because they want to leave the country.
Yeah, that's actually their reason for even going to
That's not because they want to practice.
So when they are done
nursing.
with the school, they don't really look for a job.
And there are all these nursing homes and all these nursing centers abroad.
Yeah.
They are taking them by the hundreds and thousands. So a lot of them are leaving. So you find that in those hospitals, you don't have enough medical personnel to manage, all those their patients.
Okay, we'll be going for a break. Maybe when we come back, we'll begin to talk about other challenges that our hospitals themselves are facing. This is still Development Corridor. We'll be right back. You're welcome back to Development Corridor. We're talking about our health institutions and the general health, do we call it? It's not industry, but sector.
Yeah.
So, moving away from doctors,
let's
get into the hospitals themselves, like the infrastructures and, all other medical personnel or medical staff that work with doctors. How adequate are they in Nigerian health sectors?
It's just like we just pointed out. Okay, just taking an example. You don't need those support staff if you don't have the basic equipment. Let's assume if you don't have a dialysis machine, you don't need the requisite staff that will run those dialysis
Ultrascan and all that. You don't need a...
So, and you find out, like we pointed out, that most of our hospitals are not fully equipped. I mean, look at the only ones you can say are fairly equipped, maybe the university teaching hospitals and a few private hospitals.
And those ones are not available to the common man.
They are available
to us.
If you bring your money.
No, that's the common man does
it's available.
We are common
man does not have the money to pay.
We are common men. It's not available to us.
No, it's available.
It is not, if you don't have the wherewithal to pay for it, then it's not available to you. And it's really sad. Because, why it's sad is that some of these sicknesses can actually be treated locally. But because they do not have those equipment, you find this issue of medical tourism, really,
even for those that have the money.
Yes, because if you're not sure of the equipment, you're not sure of the personnel, then if you have the funds or if you can afford it,
certainly
they will tell you not to gamble with your life. They will take the person out of the country, some other place, to get those treatment. And you see, that's also the irony of this situation. We're complaining we don't have doctors enough. We're complaining the medical equipment is not enough. Unfortunately, again, the few doctors that we have, they are not being paid. The little money that they are supposed to be paid, they are not being paid. Last 2023, there were a series of strikes, across the country, nationally, and at various street levels. Some of them lasting for 5 weeks. You can imagine the National Association of Registered Doctors calling for strike nationwide, for 5 weeks, further deteriorating the situation. And if reasons because they are not being paid, the salary is not being paid, and a whole lot of other
for government hospitals.
So you find out that the situation we find out. I remember what sometime when Dr. Ngige was the minister for health.
Labor.
Okay, labor. Yes.
Labor.
He was saying that they don't care. Any doctor that wants to leave the country, they can leave.
Reckless statement.
That we have more than enough. That shows you the premium.
And himself is a doctor.
The premium we put on these people. So I think what we need to do, Nigeria needs to declare a national emergency as far as this situation is concerned, because we're losing a lot of people in this country. Imagine minor accidents, minor infraction, minor diseases and all that people should not die. People end up dying. It's like the hospital is just a death sentence. So something drastic really needs to be done about our health sector.
Okay, though this we have talked about this in one of our programs about issues of fake drugs and all that. Drugs are still a very vital link in health delivery, health service sector. So these hospitals, particularly government hospitals, there are times you go there, they say they don't have this injection, they don't have this, they don't have this. The patient will be the one looking for these things, and some of these drugs are supposed to be stored in a cool, dry place in certain temperature. But you see individuals going to buy it and all that. How do we ensure that our hospitals have the requisite drugs required to administer health services?
You see, that's the other issue. It's just like when you go to a supermarket and you want to buy something from the supermarket, and the supermarket tells you they don't have what you want to buy. You now begin to ask yourself, are they really prepared for business? Are they serious about business? You go to a hospital, the hospital does not have the requisite drugs to be able to treat their patients. Is it because they don't have money to purchase those drugs, or they don't know where to buy those drugs, or they do not have the ability to buy those drugs, or they lack effective coordination in terms of their logistics and planning? So there are certain things that happen in this country, and it's just absurd.
And in the recent times, even most of the drugs were, well, I won't use the word most, but certain amount of drugs in circulation has been declared to be fake.
Yeah, because you see, it's a whole ripple effect. You know, like there was a TV program I was watching. It was an Indian company. They were producing this tramadol, and some spies went to, I think from America, they told them, look, they know. They have a base in Ghana, and from their base in Ghana, they ship all across West Africa.
Imagine.
So they know what they're doing, and they know it's bad, and they are doing it. You now begin to ask yourself a whole lot of questions.
But Ghana is an ECOWAS country. They shouldn't even allow that to happen.
That's the question, okay? And then our border patrol, our border check, like what is happening in Anambra State today. Okay, the drug came from wherever it came from, and ended up in the market. That is not an excuse, okay? Yes, if it is fake drug and is in the market,
it is a fake drug.
It should be confiscated.
Confiscated, yes.
But it raises a bigger question.
That's right.
How come those drugs evaded all the checkpoints across the whole country and ended up in the market, or ended up in the warehouse of some human being, where they now move those drugs to those shops and are selling them? So you see, there are big problems in this country that we really need to sit down, and think strategically about it.
I have, most of these things, because we are discussing about developmental corridor, and it's all encompassing.
That's right.
From health to education to policing and all of that. So I like to look at it in a holistic way.
Yeah.
We talked about the police the other day. Now we are talking about health. Probably maybe the next time we are talking about education. So let us look at the root cause of these things. If the tree is whole, all the branches will be whole. That means our problem stems from our administrators. How can we fix these administrators that would thereby now fix all the sectors?
You see, I remember when Okonjo-Iweala was the minister in this country. You remember that time, petroleum subsidy and all that. There were hired assassins sent after her.
Yes.
When Dora Akunyili was NAFDAC chairman, DG,
yes.
and the same Onitsha,
yes.
This fake pharmaceutical, they made an attempt on her life. Or you Okonjo, like they
even kidnapped Okonjo's
parents.
So you find that just like what you said, before Dora Akunyili, there were other DGs of pharmaceutical industries. Okay, of NAFDAC. After her, there have been other DGs. But Dora was able to create a landmark in terms, because she had a personal incident.
Yes.
A close relation of hers died because of the fake drug.
So she took it personal.
And for as long as she was there, she did something, marvelous. A lot of all those fake drugs were, checkmated. So just to agree with you, the people importing these fake drugs are human beings. They don't fly it by night, even if they use aeroplane. Yeah. The aeroplane must land at an airport. Yeah. It must land at a landing
and be checked.
And then at those airport and landing screen, you have all the retinue of security people. So how come they evade all those security and are able to bring it into the country? If you ship it in a container, how come with all the destination in all the things that are being done in terms of customs and all that, it still evades those things and gets into it. So we really need to look at ourselves, look at our system, look at our processes and our procedures, and like you said, decide to tackle the problem head on. But like we all know in this country, a lot of people are compromised and they know what they are doing and they look the other way because of the issue of corruption and compromise. So that's the problem. But when we really want to do what we really want to do, and we really need to do what we need to do, we have the resources and we have the capability to be able to do that.
Okay. Just like he said, unfortunately, it's very difficult to disconnect all these government institutions, public hospitals, teaching hospitals away from politics eventually, because all the medical directors of all these FMCs are appointed by politicians.
Political appointees.
They are political appointees. So how can health, you don't joke with health, you don't play politics with health. How can we disconnect all these appointments from politicians?
You see, one problem we have in this country...
Maybe if we revisit our laws or something.
Not necessarily that. It's the issue of political patronage.
Yes.
When you're in government and you want to appoint people, you appoint your cronies.
Those loyal to you or your party loyalists. Not people who could actually deliver on the job. Even if they are your cronies, even if they are friends, even if they are party loyalists, among those people, can't you find somebody, a professional, that can deliver on those, those targets? I remember in Lagos when this Kuti, Professor Kuti, was appointed the Minister of Health. Commissioner for...
No, Minister.
Minister.
Yes.
Minister.
Yes.
Was it
Beko. It's Beko. Beko Rasokuti.
Okay, or the elder brother. So definite things were done, and such people, you never forget them because of what they did and the impact they made on the system. So, like I said, we have all of them. They have Yorubas, Hausas, Igbos, Fulanis, and
other
ethnic groups that are well qualified. But the issue is, are we going to look on competence, or are we going to look at some other factors?
But one of the areas we also looked at competence was bringing in professors to man our electoral. That's also the lighter side. We brought professors to monitor and
Sorry again, if I can disagree. That somebody is a professor.
That's right.
Means is competent in a particular area. In that particular field does not mean that he's competent in every area. You bring a professor of...
political science.
Not just political. Now, how many professors of political science do you have that were appointed INEC commissioners? You bring a professor of English or a professor of mathematics or a vice chancellor who has a medical background, and you make him the state commissioner for INEC. He doesn't have the competence to be able to run it. He's a professor, yes, competent in a particular area. What level of exposure has the person had
with
in
electioneering,
managing election processes? That's the mistake we make. An assumption that once at a particular level,
you're master of all.
You can do anything because you're not the one doing it. You're just giving directives, and then you have a lot of people to support you. But if you don't know what is being done in that area, how can you provide leadership in that particular area?
So that's a right pegs in right hole.
That's right.
So that's what our country is.
At the end of the day, we still have to look at the population you started from and to doctors. Now, if we decide today we want to be replenishing those going out, is there any method we can use? Because the younger ones are living, the mid-age, or mid capability or mid-knowledge doctors are living. You mentioned that a medical director or chief medical director also left.
Yes.
So is there any way we can replenish this without politicizing anything? I remember P2B once said he too wasn't also bothered that people were living, because there is a way of commercializing their living, only that we didn't have that kind of program. can we establish a program such that the knowledge will be domesticated, even though people are living will have sufficient here?
You know, the problem here, like we said, we produce just about 5,000 medical doctors
Annually.
in a year. About that same 5,000 medical doctors leave Nigeria on an annual basis. So as you're producing them, an equivalent number or more is leaving. The truth of the matter is that except we provide a conducive environment for such people to operate, you won't have them. And it happens in every country. For instance, America found out that they were lacking personnel in the area of STEM, science, engineering,
Science, technology, engineering, and mathematics.
They were lacking personnel in those areas. They not only provided scholarship for people to train in those areas, they made sure that when you graduate, you get jobs, and that the salary scale was competitive.
That's right.
You can't tell a
And if you're a foreigner who come in to study, why others are having like 1 year, to try their hands on internship and all after graduation, all these them have 3 years. They just try to give you that benevolence, 2 years renewable with 1 more year renewable, believing that before that time you would have found a good job so that you will remain.
That's it.
It's incentive.
And have to continue
Yes,
the
it's incentive.
Because it is so critical that if you don't have those personnel and those professionals, the society cannot grow. There is no society that will survive and grow if we don't have enough medical
Eventually, we still have to
doctors.
go back to the politics.
Exactly.
The people that have the power
Yes.
to implement these programs.
Yes.
Think of how to make it conducive for those who have the knowledge to work and also to be able to retrain the fresh ones coming and probably build more teaching hospitals too, to get more hands to train. I think probably that's where we're going to be cutting it off for now. Maybe when next we come back to development corridor, we'll be going back to that policing. So that, security, health, these are very, very vital things. If they are not there, all these other finance or whatever have no place to stay and there's no place to function. All right. Thank you so much, Mr. Beta. And thank you, Kingsley, for always being here with me.
Thank you.
Even when I don't want to see you.
Are you sure about that?
This is still Development Corridor. So we'll continue next time. Thank you for watching.